Okay, folks, I see that it's 10:30. I'll call November 6th, 18th meeting of the Neighbors of Dunn County to order. Call a roll. I see we're all here except for Supervisor Jensen, I believe. We also have Supervisor Bartlett with us. Approval of minutes. Is there a motion to approve the minutes?
I would move to
Supervisor
approve.
McCulloch moves.
Kinnear.
We have a second.
Supervisor Kinnear, second.
Thank you. We have a second by Supervisor Kinnear. Is there any questions? Are there any questions? Comments, changes? Hearing none, all those in favor say aye of approving.
Aye.
Opposed? Carried. Do we have any public comment?
No public comment.
Thank you. Carmen, we'll get right into your administrator's report.
Thank you. So as always, we start with Quality Assurance Steering Committee. This month, we actually haven't had that yet. It'll be today, right after this meeting. We had, which I'll get into later, we had our central survey last week, so we postponed it instead of having a typically longer meeting in the middle of the last day of survey. We moved it to this week. So I don't have any updates for that committee. But while we're on that item, it's kind of related, I guess. Today I have Laura Briesmeister with us on the Zoom call. I don't believe it hit last month's numbers for our turnover, but we did have our social services mentor and admissions coordinator actually leave us to go to another department of Dunn County. So Tracy Fisher, who had been with us, I believe it was 12 years. She moved to the ADRC as the ADRC director. So still with Dunn County, just in a different role. So Laura is our new social services mentor and admissions coordinator. She actually was previously a social worker here, currently was, and then transitioned into this position. So we're excited to have her start, but I just invited her to come on. She has to run quickly, but just so that put a face to the name kind of situation.
Well, half the face is covered, but it is nice to see someone.
There you go.
Hi.
Welcome.
Thank you.
Welcome aboard.
Thank you.
So she will be completing in terms of this meeting, she will be continuing on with the referral activity report going forward for the next months and being on if need be for meetings. So
Great.
right. Thanks, Laura. All right. Next, we have the employment activity report. So I'll give that to Chris.
Good morning, and I'd like to offer Supervisor Jensen is over at the Government Center trying to get onto the meeting. So somebody is helping him over there to get on.
Okay.
So I'll just kind of jump into the employment report for October. We did have a number of interviews. We had 14, 5 of them being for the social service director position. So outside of that, we held 9 interviews. We offered 8 positions, 7 of which were accepted. None higher than a step 3 because there was no licensed staff hired that month. We did have an influx of resignations. For October, we did have 13 resignations, and those are listed here. Actually, one of them that would have resigned during that period is actually coming back the end of this month as being rehired. So it's kind of a good news. We can skip down to open positions. Those numbers were adjusted, with the hiring and people resigning and retiring. So we did have a retirement this month too. We go down to the active leaves of absences. Not much has changed, kind of a total of 25 active leaves of absences right now. Most, the Lions Den share of them are educational related. We go down to work comp lost hours, no lost hours, not even much for instant reports for October, which is always a good thing. And if we pop down the next line, is lost shifts, missed shifts due to COVID-19 issues, and it was 24 shifts, kind of a mix of 8s and 12s, so roughly about 192 hours missed for COVID related issues.
I'll just add
Anybody?
in there too
Oh,
that
go ahead.
this, oh, sorry, Chris.
I'm
So
done.
this is what we had talked about the last couple of months that, or especially last month, that we warned that because of our reporting dates for this, that these resignations were the ones that we had been talking about at our September or our October meeting. But we always are kind of a half month behind by the time we get to this meeting. So this is what we were referring to when we had that rather lengthy discussion last month in regards to employment. So it's definitely not pretty, but this was what we were anticipating the numbers to look like for this month. Are there any questions in relation to the employment activity report?
Well, I have-
Supervisor Kinnear.
Go ahead, Mike.
Okay, last month, Carmen, you mentioned having therapists checking out to see whether they can work out or help out or anything. How's that going?
So we did work with our therapy department on that. At this point, we haven't moved forward yet with that as the cost is rather extensive, but we're working with them to see if we can lower that. It goes based on who is working. So a therapist costs more than like a therapy assistant. And the rate that they had given us was calculated at the therapist rate, but we have more therapy assistants. So we're in negotiations with rates for that at this point.
Okay, thank you. And the other question I have is, we're still looking to get a CNA curriculum. Is that correct? Or where's that going?
Yeah, so we do have CNA students right now that are through CVTC. We actually sat on a call, I believe it was 2 weeks ago now, for a new form of CNA training that's actually online. That would be they would do their clinicals here. It would be done through us, but it's online. So we did submit a request through the state with that as well, because that way it wouldn't need to have an instructor here for the whole time frame, because the instruction would be online and then they would just need it for the clinical part. So we sat through a webinar on that. I believe it was 2 weeks ago now, and working with the state on that, because that would alleviate the need for the instructor as well. So that's what we're moving forward right now.
So you think that might be real helpful, huh?
Mm-hmm. Yeah, so it's a new program. They've done it in a few other states, apparently. I believe the people that were on the call were from California, but they're starting it now in Wisconsin. So they're partnering with the state, with DHS, and we will be then partnering with both this if we get approved and everything, be partnering with both this company as well as the state. So it's kind of a dual partnership thing. So we got the information through DHS, the State Department of Health and Human Services, and then listened to the webinar and are interested in moving forward with that, because it would be a lot easier than having a full-time instructor and going through that process as well. And then I truly believe it'll be more enticing too for people to take, since they wouldn't have to be here at certain times. They can take it like online schooling for college would be, where you kind of do your work when you have time to do it and everything else. So I think it'll be a really good program.
Good.
Great. Way to follow through on that. So we wouldn't even need an instructor here at all?
We would have to have an instructor or one of our nurses be kind of as the instructor, or maybe even a couple of them for the clinical part, but it wouldn't be for the like the book classroom part. So the traditional CNA course includes both like textbook classroom learning of the skills as well as regulations and things like that. And then it also then has the clinical part of it. So we would still have to have someone overseeing the students during the clinicals, but it would cut that time more than in half. So that's beneficial for timing, and it might be something we would be able to have a few of our nurses trained to be the supervisors instead of finding someone that would be able to do that full time.
Thank you very much. And thank you, Mr. Johnson, for letting me ask my questions.
Absolutely. Are there any other questions? Well, I guess we can carry on then.
Okay, next is the referral report. So this looks very similar to the last couple of months. We still are not admitting, as we talked about last month, due to staffing. We have been hopeful to be able to admit to maybe our long-term care households that are have people that have passed away or discharged, to kind of keep at current what we can staff. So if we say 1 to 8, we have 2 people pass away, we're still staffing then 1 to 6, so we could have 2 additional people there. So we're still looking at that. At this point, we haven't started doing that yet. We have begun to get a couple more agency staff in and signed on, both through our typical routes of agency staff, as well as a program that the state has started, that the state of Wisconsin is partnering with an agency, and then we partner with both the agency and the state actually picks up 60% of the bill. So that's a beneficial program to us to make agency staffing more cost friendly. The only problem is everybody wants to do it. So the number of staff is also kind of small, but we have had 1 CNA start through that program. So we're hoping to get more as well. So at that point, once we get more staff in, we'll be looking at admitting more likely than not than right now. But at this point, we have not started admitting. Our only admits have been people who have been admitted to the hospital from us and then brought back to us. So we will still take people back, but not new admissions at this point. Any questions on the referral report? Okay, next would be the environmental report with Scott.
Good morning, everyone.
Morning, Scott.
I guess the big thing been going on for us was getting things prepped and ready for winter. We've got that ready to go. We have been having issues with our AON unit that is this is a heating and cooling unit that is on the roof of the building. This serves the kitchen area. Having problems with the heating on that. So we've got a company that came and looked at it, and we'll be back tomorrow. Hopefully have it all up and running for the kitchen to keep things warm there. This unit is not on the geo system. It's a gas-fired unit. It hasn't been worked on for a couple of years, and from my understanding in the past, there has been some issues every couple of years with the unit. Trying to see if we can get this remedied so that we have less problems going into the future with it. I know the staff in the kitchen is probably getting sick of the 50-degree temperatures when they come in the morning. And once the guys get it fired up, it warms up pretty quickly in there. But having issues with some of the burners not firing on it. So hopefully we'll get that taken care of. Carmen mentioned that we had a central survey. I know she's going to touch on it here in a little bit. I'll just mention that for life safety code, we had two sites, very minor sites on that. Josh did a very good job of having everything documented for the engineer. The engineer went through it pretty quickly. Minimal issues. A couple things that were pointed out that we're not site worthy that we will get taken care of, so that they don't see those on the next survey. All in all, it was a very good survey for us. Couple of things that I want to bring up to the committee. There's been conversation Paul Miller and I have talked about is putting some prairie grass out in front of the neighbor's facility. I do have let's see if I can share this screen with you guys. Right here. This is a map of the area we're talking about is in this outline in black. It's area that now is mowed maybe once a year, taller grass. Talking with Chase in Land and Water, conservation about getting this covered by a grant, so it wouldn't cost the county any money, the neighbors any money, but putting this area into a prairie grass area and work toward developing this into an area that would be with walking paths, some signage to show what people are looking at, possibly benches for people that if they walk through there, they could sit down and enjoy the area. It's kind of a more of a nature area for people when they come to visit a resident or anything. They would have an area that they could go take a break or walk out through there, maybe if they could take residents out there. Working with Chase on it, the first thing that would have to be done would be a soil prep, either tillage or with herbicide. Then once it's seeded, the first year you really don't see anything out of it as far as change. Second year it kind of rests. Then maybe the third year it starts taking off. So facilities would still have to mow it once a year. And then once it really takes off and starts going, then it would get on a schedule of a prescribed burn to maintain it. Like we do with some of our other properties that have some of the natural prairie grasses on. But the good part would be, like I said, if the grant covers everything, there would be no cost to the county on this. So we're working with him. Just wanted to bring that to you guys' attention.
That'd be nice.
Yeah, it would be kind of a nice thing.
Mhm.
Let's see. I got to get rid of my screen and back to there. Second item bringing up to see if there is any interest in placing a fountain out in front of the neighbor's facility. We took the fountain, removed it in front of the government center building. That fountain was dedicated to long-term care workers when the government center was Dunn County Healthcare Center. We removed it. It wasn't really fitting for the government center anymore. It's more of a nursing home thing. The fountain was originally in front of the original old asylum building that was held behind government center. Just wanted to bring it to the committee to put it, plant it in your minds if there was any interest in placing this fountain out in front of the neighbors. We were able to remove the concrete fountain part by itself, all intact. The fountain was unbolted and removed. We have that in storage. So in order to place it somewhere, facilities would have to do a little work as far as getting a water supply to it, and prepping the area to set this, getting some electrical to it. It wouldn't be too bad to put it somewhere depending on the spot that was chosen, if that was to happen. The other option of the fountain, if it's not going to be used, would the county want to do something else with the fountain as far as donating it to historical society or something like that? But just kind of want to put that out there, take some consideration of it and get your guys' ideas. Nothing that is pressing as far as action or anything at this point, just getting it out there and let you guys know where we're at with that. Third thing is there's been some conversation about the sign for the neighbors that is out by the highway, talking about whether that sign would be better to be redone and made to more match the signs, like the new sign in front of the government center or the new highway sign, to have the new county street logo on there, make it so that it's more legible at highway speed. So there's been conversation of that. So I'd like to get any input you guys have on that in the future, so that we can make a plan as far as doing something with that sign, making it more readable as people are going down the highway. I think that is about all I have for you guys.
Excuse me, I don't know if anybody can see me because I kind of got, that fountain is well over 100 years old that you're talking about. That was in front
Yes.
of the old building. So it'd be a shame just to destroy it. So hopefully we can find some place for it.
Is it in pretty good shape, Scott?
It is in pretty good shape. Back in 99 to 2000 there, it was brought back out of storage and it was painted and it was
Yep.
placed in front of the building. So it's been out there, was out there for 20 plus years. It is in need of maybe some repainting or that, but it is in good condition. And that's why we unbolted it and we put it in storage. So it's tucked away. It's safe.
Mhm.
Chair Bartlett?
I would suggest that Scott come up with an estimate, put it in front of the neighbors and maybe a plan to show where it would go. And that would be, some information that we could use to move forward on this.
Sounds like a good idea.
I can do
Mr.
that.
Chair,
Yes.
Paul Miller. I'm sorry,
Yes,
I
sir.
can't turn on my video for some reason. I've never encountered this before. It's telling me when I click on my video that it failed to start the video camera. Please select another video camera in the settings. So I'm not sure what's going on there, but I just wanted to add to what Scott said about the sign. I would be interested in hearing from committee members if they share in the sentiment that Scott and I share. The sign on Stout Road for the neighbors is essentially unreadable when you're moving at speed. You see something that I think is a tree, but you really have to be looking at it to see that it says the neighbors of Dunn County. And we've talked in the past with facilities committee about the idea of building the identity of a county campus along the north side of Stout, extending from the neighbors east all the way to the highway building, and using elements to identify it as a county campus. And one of those is signage. You've all seen the sign that we put up in front of what's now the government center. That's the white and green with that yellow and green logo of the county. We put one up for highway department as well. We are going to be talking about next year, if we could find the funds, or the year after, putting a new freestanding sign in the same style on the landscape area in front of the judicial center. So it would be good, although not as fancy, perhaps, but I think it would be very good if we replace the sign face for the neighbors to match that as well. The white and the green, use that logo that the executive committee selected, that we've incorporated, the yellow and green logo, which is the outline of the county. And instead of saying, as it says, Dunn County Government Center, Dunn County Highway, Dunn County Judicial, it would say the neighbors of Dunn County. But using that element, that design, to tie it in so that people understand as they drive along, hey, this is the stretch of the Dunn County government facilities along this side. So I'm interested in hearing from individual members of the committee. What do you think?
Go ahead, Kelly.
Yeah, I was gonna, after Dave's comment, I was gonna say that I would love to see what it would cost to get the sign done. I think it would be both nice in terms of having aesthetic unity in the signage along there, and it would be a service to people who are looking to find the neighbors to come visit. It would be, I know that I am always irritated when I miss a sign and have to drive and turn around, and I suspect I'm not alone in that, and that would be a nice thing. And I know that with the sign plan that the city has been implementing, sort of that unity of aesthetic to let people know that this is, this is us, has been a very nice thing to see.
Yeah, I think it would be a good idea to look into it, see what it would cost. It would be nice.
This is Sarah. May I speak again, please?
Absolutely, Sarah.
Yeah,
Are you there, Sarah?
I think she just cut herself off.
Uh-oh. Well, Maybe
Before
she'll
we're
get
in it,
back.
I'm also broadly in favor of the fountain.
Yeah,
Supervisor
I
Smith?
believe it would definitely bring awareness to the facilities that we have here in Dunn County. So if the price would be reasonable, I think it would be a good thing.
Mike, you have anything to say, or? Mike says thumbs up. Okay. Okay. Well, check into it if you would, Scott. We'll go from there, so.
I will definitely check into it and I will update as soon as I have more information.
Thank you.
Thank you.
Is there anything else? Do you have anything else, Scott, or we go back into Carmen's report?
Oh, I am good.
Okay.
Thank you.
All right, thanks, Scott. So next is a Central survey. As we mentioned a couple of times, Central received their annual survey last week. So we are happy to say that we are done with annual surveys for 2021. So we have had all three now. We had East in June, West in August, and then Central this past week. It did go well. We were hoping for a clean sweep of all having citation free, but we did have a couple of very minor citations, both on the health side and on life safety code side. So we did receive 2 D-level citations for health, both primarily related to documentation. D-level is the lowest level of citation you can get that is on the scale that you have to do a plan of correction. There are some minor citations that are even lower than that, but those are typically not seen very commonly. So D-level is the typical lowest citation that you'll receive, and we received 2 D-level citations. It just means that it was an isolated incident and that it was something that did not cause any harm and only had potential to cause minimal harm. So it's not a terrible thing. They're just small citations. Both were related to wound documentation. So no harm was done. There was no worsening of a wound or anything like that. So it was just some re-education of nursing staff on wound documentation and then some policy changes in relation to wounds. So all in all, a good health side of the survey. Just for reference, the state average for citations is 6.6 citations and the national average is 8.3. So 2 small citations is still well above average for a health survey. And then as far as life safety code, I know Scott mentioned them a little bit as well. We did receive 2 also D-level citations for life safety code, which is very common to have a couple of things. So we had a citation in relation to our PPE storage was the one that was kind of stung a little bit because we have extra PPE for trying to prevent COVID and the spread of COVID here. And it wasn't stored in a proper room. We actually have it in the boardroom that this meeting was typically held in, which doesn't have an automatically closing door, which is necessary for storage rooms. So an easy fix to add an automatic closing door on that. And then the other citation was in relation to, also kind of in relation to storage, but having something placed in front of an electrical panel, which can't have anything directly in front of. So those were just moved. So that was 2 easy fixes. And we are now back in compliance. So that was our life safety code survey. So we'll receive the actual statement of deficiencies sometime soon. It's normally 10 to 12 business days after the survey, and then we'll write the formal plan of corrections and move forward from that. It was also a different survey because they came to Central, which is where our 2 closed households are. So we had 4 surveyors for 15 residents. So that was also a bit more stress and oversight than what we're used to on surveys. So our staff dealt with a lot of eyes on them all day, which even when you're doing everything right, it's still nerve-wracking. So they did an awesome job. 4 surveyors looking at 15 people is a lot of eyes on 15 people. So we are very proud of our staff for maintaining, doing what they should be doing and not getting too nervous or anything like that. So it was all in all a good survey.
Very nice.
Any questions about survey at all? Okay, yeah, so that was our last survey for the year. So we will anticipate seeing the surveyors again in East will be our next building, which will be sometime in the spring. I believe our window opens in April. Typically it's about a year out, but it can be anywhere from 9 to 15 months. And they came in June last year, so, or this year. So we'll see them in a few months in East. And finally, on my report is the COVID-19 update, as always. So as you saw in the employment activity report, we hadn't had as many hours missed this past month for COVID as we have been seeing. Some of our larger months have gotten up to 400, 500 hours, and we were only a little over 100 hours of missed time. So we have had a decline in the number of staff out for COVID, but it's not the same as what's going on in our community. There's been a huge incline in an increase in COVID-19 in our area, as well as bigger communities around us. I know Minnesota has seen the highest numbers that they've seen throughout the entire pandemic. We're reaching the numbers that we saw last fall in the pandemic in our county. So it's definitely not going anywhere at this point. We are fortunate that we haven't had any resident outbreaks when we have had staff positives here at the county or at the neighbors since last November when we had our one resident outbreak of 12 people. We haven't had any since then, so that's a very fortunate thing. At this point, the biggest news in COVID is the vaccine mandate. So as everyone is aware, that came out on the 5th. So we are gearing up for that. We have issued notices to our staff regarding the vaccine mandate that were worked through with HR that have been sent out. Basically, all staff are required to get the first dose of vaccine by December 5th and be fully vaccinated. And in terms of this rule, it just means getting your second dose, not being 2 weeks out from your second dose. They did clarify that by January 4th. So we are at this point about 70% vaccinated. We have in the 40s, low 40s of number of staff that have not received a vaccine. We're working with all of those staff to see what their plan is and preparing for some people to leave, as well as some people to get vaccinated and or have religious or medical exemptions, which will be worked through our HR department. So we're kind of at the beginning of this and waiting to see what people are going to do. The request for the exemptions will go through HR, which Heather and her team are prepared to handle as well. In terms of vaccines here at the neighbors, we are offering them here on site. We actually did get our booster shots here at the neighbors too this month. So that was exciting. We got them for our residents as well as any staff who would like them. In terms of the mandate, it does not require the booster at this time. It would only be the first 2 doses of either Pfizer or Moderna or the single dose of Janssen. So it would not require the booster at this point, but we are offering them here as well as all the residents who would like to receive them did receive them. So that was a benefit for all of our residents. The only other change in terms of COVID is actually last Friday, the visitation policy or regulation changed. Previously, the visitation regulation stated that if we had an outbreak, so meaning either a staff member or resident testing positive, that we had to restrict visitation for a certain period of time. That has since changed just less than a week ago, saying that we will no longer be required to restrict visitation and actually that we cannot restrict visitation. They have stated, which makes a lot of sense, that it is publicly available for all people to get vaccinated if they would like to be. So if they're coming into the building that had a potential exposure, that we have to notify them of that, but it's at their own risk if they'd like to come in. So our residents are vaccinated, and if they were exposed by a staff, at that point, they've already been exposed. It's more the visitors' risk for coming in. And since vaccines are widely available, and if people wanted to be vaccinated, they could have been. So they're allowing visitors in, which I believe is a really good thing. It's not fair to their residents to have them restricted from visitors because a staff member tested positive. If the visitor wants to come in at that point, they can. So that changed on the 12th. Are there any questions in regard to COVID at all? Okay. Are there any other questions for me in general?
Supervisor Kennedy, you had a question when Scott was up. You
Well,
want to bring it up? We lost you.
I know you did. I was trying to say that there was quite a history to the signage thing. And for many, many years, the employees begged the county to put a sign in front of the healthcare center. And they told us that the one out on the highway was sufficient. So we finally got them to give us a sign, put up a sign, and they gave us the one identical to the highway, which most of us felt was that old rusty thing. So I just agree that we need to have a decent sign at the neighbors, or so that people know that the neighbors is there. So that's all I was saying, was that there's quite a history to that sign.
Okay.
It was a shame we could never have a sign before we fought for one.
Okay. Anything else?
Chairman Johnson,
Yes.
may I, sir?
Yes.
Carmen, just to confirm, so Carmen, so Arrowhead and Fireside are the two closed? They're the only two that are closed?
Correct.
Okay, and is our intern still with us, Brittany Johnson?
She is not. So she actually moved. She has been gone for quite a few months now. So she moved and then completed her internship at another place in a different state. So she had been interested in moving outside of Wisconsin, Minnesota area and moved to a different state. She originally was supposed to do her internship in New York. And then she came to us when New York wasn't going to allow internships. So she had aspirations to live elsewhere.
Okay.
Thank you.
Anything else for Carmen? Hearing none, we'll get into the reviewing the vouchers. Anybody have any questions on the vouchers? I'm sure we all went through them one by one. No one has any questions? Okay, we'll get into the financial report. Jane.
Hi
Morning.
there, committee and Sharon. Thank you for having me. In the vouchers, you will see a charge for insurance that isn't actually a new charge. We're having a little problem with some SAP issues and purchase orders. So the $10,000 in each building that you see there is not a new charge. Also on the horizon is the East has a $78,000 new charge that didn't show up before, but everything was paid and it's all under control and netting out. Just some SAP cleanup there relating to the vouchers. If we look at the days per month report, the census is still heavy in Medicaid, and Medicare clients have, we have very, very few Medicare A clients, which will not help our general net bottom line, because that's where our money has been made in the past. So that's the census update. I think the next item is usually the pool staff report. Pool staff for East is a little high. I know in September, well, actually August, we didn't have a lot of invoices in there. So again, it's due to the timing of the posting of the bills. The year-to-date total for the campus at the bottom, kind of middle, that $1,400,000 is what we've paid to date. So I anticipate we'll catch up a little, quite a bit more to the 2020 total. I believe overall we're spending, I think, correct me if I'm wrong, Carmen, but we're using agency staff as much as a percentage of our staff as much as last year.
Sometimes, yes, we did have a period of time that we did not have hardly any agency staff just because we could not get them. But at this point, I would say yes, as a percentage wise. But previous in the last couple of months, we haven't been able to get agency staff. So there's only been a handful of them. Sometimes they are more willing to pick up overtime and things like that too, especially if they're from out of state. They're here just to work. So if we need open shifts, they're willing to pick them up. So sometimes even if we don't have the numbers of people, it may be the hours and money spent as well, equal out to the percentage. So it kind of ebbs and flows, but at this point, we're getting back to that number. Yeah.
Okay. The aging report, and you'll see the bottom line total of $1,188,000 is still within a reasonable amount. We have $160,000 of revenue that we just posted. The backdated Medicaid rates have been pulled in there. So that was $160,000 that we just put in there to the receivables and distributed that. That money should be coming in shortly and then come off the books again as received. Getting a little bit high in the middle ranges there, and we need to pay attention to that. We are down one staff member. Our experienced biller left for a different position, and we have an LTE filling in, and it's kind of a slower period without the new admissions and the Medicare A. So we are doing all right with that one. You'll see a negative $49,000 in the 61 to 90 days. There was a VA reconciliation done, and this report is run by transaction dates. So it nets out in the end, but by transaction date, it hit in one period, and then the offsetting transaction hit in another. So that is still okay. We're not needing to refund anybody that large amount. Any questions on the aging report? Okay. And then to the financials. We are fine tuning the billing software. So you might see some variances, shouldn't see a whole lot, preparing for year end and making sure our books are clean. What I see in these financials is the supplemental payment is above average. We got an extra payment earlier in the year. And just this morning, we have a notification. I don't know if you've seen it, Carmen, but the supplemental payment notice just came in for the end of the 21-22 year. It's split by the state year, the June to June. And it's up a little bit higher than usual. And I believe that is because, well, partially because there's more money available, and our higher Medicaid census that we've been talking about, it pays on a per day or per resident basis of the previous year. So that is helping us in this case. So, so that's good news. Supplemental payment from the state will be increasing.
And we will see that money in December. So we submit those now and they get twice a year payments. So December and then in the summer as well.
Yep. So we'll get over $600,000 coming in there. 650,900 to be exact. But some of that is accrued already within these numbers. We'll just keep accruing it. Senior meals are doing well. Still ahead of budget, and compared to the expenses, it's netting out to be positive. So that's, I don't see that reversing the trend at all, even with the COVID. The increases still seem to be there. We had 3 pay periods in October, so part of the labor expense will be a little bit higher than normal because of the 3 pay periods. And the administration, again, due to the SAP errors, user error, I'll own that. The purchase orders were not done correctly, so we're cleaning that up. But it shows as an expense of $187,000 for her actual month to date in administration. But in the end, it does balance out on the year to date. So that is all okay.
And that was primarily the bed tax, actually, correct?
Yep, it was paid. It just didn't post to the report that I used to run this report. When I balanced to a different report, there was an error, a difference, so we reconciled it before the auditors find those things. That's always the best way to do that. So far, I haven't added any more COVID dollars from the provider relief funds. I'm getting that balanced with Department of Human Services as well. They get some of that money that's in the receivable account. And I hope to be posting that in November. So we'll see at least that $152,000 posted back up in the revenue, and hopefully some more. And then the net income year to date would be higher than that, but the COVID money truly is keeping us in the black. And we're glad to be able to offset those additional expenses that we have because of COVID. Any questions?
Anyone have any questions? I guess not. Thank you, Jane.
Thank you.
Okay. Is there a motion to accept the vouchers and the financial reports? Do we have a motion anywhere?
So moved. So moved.
Supervisor Jensen seconds. Is there any other comments or questions? Hearing none, all those in favor say aye.
Aye.
Opposed?
Aye.
Carried. Did you say aye, Mike? Opposed? Supervisor Kinnear, you said, okay. I was a little slower, a little ahead or something. Okay, is there, anybody have anything else at all?
No.
If not, we are adjourned. Happy Thanksgiving, everyone.
Yeah, you too.
Yeah.